Well, we all want to be healthy and live long, productive lives. That means making sure you get to those doctor's appointments and exams. My physical's actually today.
Is it?
Yeah.
Oh, all right. Well, they can be expensive, but there's one place in Connecticut that might be able to help.
And here to tell us about health centers in Connecticut and how you can benefit are Andrea Ravitz of Access Health CT and Ken Laime from the Community Health Center Association of Connecticut. Thank you so much for being.
That's a long list, isn't it?
No, we're happy to have both of you, but we really want to focus on that people often are leaving maybe benefits on the table because a lot of, when it comes to primary health and those screenings, they're often included in your insurance. You're not even paying for them, right?
Yeah, and I think we're all guilty of that. You know, life gets in the way, and especially right now and during the summer, Access Health Connecticut has been pushing, this message that it's really important to focus on your health, get your kids to go to their doctor's appointments, and yourself as well. You know, if you're sick, everybody kind of suffers in the house. So taking advantage of all the benefits in your plan is crucial.
Oh, yeah. So talk a little bit about Access Health Connecticut and what it does.
So Access Health Connecticut is an organization that provides healthcare coverage for individuals, and they can qualify for Medicaid, which is the state insurance, or they can qualify for what we call the private healthcare coverage through both of our participating insurance companies. So all they have to do is, just to get more information, they can visit accesshealthct.com and see if they qualify. You know, close to 80% of our customers qualify for financial help, and that is kind of what makes us different. We are the only organization where people can qualify for financial help. So once you get the plan, choose a doctor, use your benefits so that you can be well.
And Ken, talk about the community health center model. Why is that important? What even is a community health center?
Sure. There are 17 community health centers in the state of Connecticut. Many have satellites, so if you look at access points, that we kind of call that, it's more like 80 places you could go throughout the state, covers the entire state. So a community health center is what it is. It's a community-based organization that provides healthcare services, and it's a comprehensive group of services. So it's not just, go to your primary care doc, and then next week if you have a behavioral health issue, you can go see somebody else, and then if you have to go see your dentist, you go see somebody else. These are all under one roof. So you get comprehensive primary care at these centers, and all of the centers provide those. A lot of school-based clinics also, so we are spread out through the whole state. And they also take some of those other insurances that were mentioned. So the private insurance, it's not that they don't take those at all. They'll accept anyone, and I mean anyone, whether there's ability to pay or not. One of the real features of a community health center is because of some of the federal funding, they actually cover anyone who needs additional services without having access to insurance issues or financial aid.
So the main focus is your primary care, right? To get your physical,
care is
get
key. It's have your doctor, having your own doctor to go to that center and get to know each other. You get to know what it is. That's the best version of primary care.
Do you have tips on how to find a good doctor? Like who's going to be a good doctor for you?
Well, a good fit for you, if you live in that community, that's a good place to go. That's a very first, because they understand the community. They're really involved. These are organizations that take a huge point of their time to make sure, even their boards of directors are community members, so they're very focused on community. So that's where you'd find those services.
And Andrea, if people want to just get a little access to these community health centers, a good time is next week, where
Absolutely.
It is National Health Center Week.
Yeah.
So can you walk in sometimes, or is it hard to get appointments, or?
Yeah, so we're supporting a lot of the centers, and they're vital for our success and the way that we are, improving our commitment to the people that we serve. And especially during the open enrollment period, these centers play a crucial role, which is to help people enroll in healthcare coverage. And again, this is a no wrong door. Not only from an enrollment perspective, we welcome everyone. We allow them, to ask questions in the language that they prefer. But to Ken's point, this is a great place to not only, get enrolled, but also use those benefits right in that place.
And you're going to have a bunch of different events next week where people can just check out the community health center in their neighborhood.
National Health Center Week is the first week in August, and many of the health centers have, giveaways, backpacks, different programs, screening programs. On our website, on our Community Health Center Association of Connecticut, CHC Act website.
Yep.
There's a full events calendar. You can get all those kind of things. And WFSB has offered also to provide those kind of listings for people to take a look get online and go see them.
Perfect. Thank you
Great.
so much.
Thank
And here's
you, yes.
the web address again, chdact.org, National Health Center Week. Again, that's August 4th until August 10th. So check it out.
Yeah, there are 17 community health centers in Connecticut. For all the details, visit again chdact.org and click on events.
All right. And to learn more about Access Health, you can visit accesshealthct.com.